The World Health Organization is wrapping up a month-long visit to Wuhan, China. A team of researchers has been looking into the origins of the coronavirus and is now debunking a theory it was leaked from a lab in the Chinese city. Meanwhile, the demand for coronavirus vaccines is growing here in the U.S. The nation is fighting to get ahead of more contagious variants, and experts are urging Americans not to let their guard down despite a recent drop in infections. The U.S. has confirmed more than 27.1 million infections since the pandemic began. The death toll stands at more than 467,000. Carter Evans reports from Los Angeles.
Tonight, California's largest mass vaccination site administering its first shots at the home of the San Francisco 49ers. But the state still can't get the vaccine fast enough.
It's an issue now of scarcity. It's an issue of supply.
This week, Los Angeles County is reserving more than half of its vaccine supply for people in need of a second dose. In Alabama, several counties are only offering second doses. More than 30 million Americans have received a first dose of the Pfizer or Moderna vaccine, but less than a third have received their second.
We really need to get to 3 to 4 million immunizations a day to really get ahead of this.
The Biden administration says it's increasing available doses by 500,000 starting next week, and Pfizer says it's figured out how to cut vaccine production time nearly in half. But it means nothing if you can't get shots into arms fast. That's where Air Force General Glenn Van Herk comes in. He's in charge of the massive military effort to staff some vaccination sites with up to 10,000 active duty service members, and he spoke with us exclusively.
I expect forces to deploy in this upcoming weekend to be ready to go early next week.
Beginning with troops to staff a new vaccination site in hard-hit Los Angeles,
which will be capable of delivering around 3,000, 6,000 shots per day.
It sounds like a lot, but we need millions of shots.
The FEMA director assures me that we're ramping up capacity right now.
California teachers are still waiting for their turn at vaccination sites like this one, and tonight CBS News has learned that CDC guidance on reopening schools expected later this week will say that teachers do not need to get vaccinated before going back to the classroom, as long as the schools follow safety protocols like social distancing and wearing masks. But Elaine, the rules are still being finalized, and the guidance could change.
Carter Evans, thank you. Dr. Teresa Amato joins me now. She's the Director of Emergency Medicine at Long Island Jewish Forest Hills. Dr. Amato, thanks for joining us. Less than 10 million Americans have received 2 doses of the vaccine. How many people need to be fully vaccinated for the U.S. to get a handle on this pandemic and get ahead of the emerging variants?
So right now, if you look at the numbers, we're doing close to or over 1 million vaccines a day. And if you think of where we were just a few weeks ago, that's quite a feat. And it's been really incredible to watch it ramping up. The goal is to get hopefully to somewhere around 3 million vaccines a day. Again, that sounds almost insurmountable, but we've gotten to 1 million. We're going to get to 3 million. Great to hear that the Army is going to get involved. Again, the healthcare workers that are out there on the front line fighting the virus are also expected to be giving this vaccine. So at some point, we do need some extra hands to give it out. To get to where we're going to call it herd immunity or enough people vaccinated to really think we can get life back to normal, you're talking pretty high numbers, probably somewhere between 75 and 90% of the population fully vaccinated in order to have herd immunity.
You know, Doctor, some people who received their second dose of the vaccine are reporting more intense side effects than the first dose, including fever, chills, and swelling of the arm. What is it, Doctor, about these vaccines that causes such a strong reaction after that second injection?
So I can speak personally of this. I definitely had some symptoms after my second vaccine, nothing that some Tylenol and some extra water didn't cover. I was achy, I had a low-grade fever, headache, and my arm was quite sore. But I actually looked at that as a very positive response. That means my immune system really was kicking in full gear. When people feel sick from a cold or viruses, really what makes you feel unwell is your immune response responding to that virus. So it's expected after your first vaccine, you start to get some antibodies to build up. And when you get that second shot, that's that booster. And so it's not unexpected for people to get some symptoms like fever, chills, body aches. Again, happened to me. It was less than one day, felt great the next day when I woke up.
All right. Well, how can people prepare before getting vaccinated? And what do you advise for those who may be experiencing stronger side effects? Basically do what you did, hydrate, take some Tylenol.
Mm-hmm. And if you have a low-grade fever, I'm not allowed to actually go into work with a fever, although it's expected with the vaccine. If it hadn't been for that, I would have been able to go to work. So I wasn't so sick where I couldn't, function. I just stayed home for one day. So I would say, if you're getting your second shot, try to keep your schedule light the next day if you can. You may have to be working from home for just a day. Tylenol, over-the-counter acetaminophen, and over-the-counter ibuprofen, and some water and hydrate, and most people do just fine.
Well, the FDA, we know, is going to be meeting in a little more than 2 weeks to consider Johnson & Johnson's vaccine for emergency use. And we're also monitoring concerns over the Oxford AstraZeneca vaccine. During the trial, it was found to have minimal protection against the variant first identified in South Africa. Doctor, how big of a setback could that be?
Well, it was disappointing to hear, but I wouldn't quite give up on it yet. We didn't really get the data for whether it can prevent the more severe COVID virus infection. So does it decrease ICU admissions is really what we would want to see. So, if the vaccine can prevent that, it still may be worth using. Right now, when you look at the 2,000 subjects that they did the trial on, they were quite young, in their 30s. And so, we're not quite sure, how this would affect the elderly. Would it prevent them from having severe illness? I mean, the data just isn't back yet. But yeah, it was disappointing to hear that there was some data that showed that it wasn't quite effective against mild and moderate. But again, as a clinician, I care about the more severe response to COVID. So I wouldn't write it off yet until that data comes back.
Well, coronavirus infections have fallen in recent weeks, but the White House is urging Americans to not let down their guard because of these emerging variants. What are you seeing, Dr. Amato, on the front lines? Have there been fewer COVID patients? And how are you and your colleagues preparing in the event that these strains cause another wave?
So we follow the numbers very carefully. Several times a day, we look at the number of admissions, the number of patients that we see that are treat and release, the number of patients that are being tested. Of the patients being tested, how many are positive? We look at our community, we look at our hospital, we look at our surrounding hospitals. I can assure you we go over these numbers over and over again. I would say, obviously we are very prepared if there were to be another wave, and hopefully there's not. But just like we saw last spring, as the cases went down and we were all feeling quite relieved, we know that COVID's still here, and all it takes is one, super spreader or one person to not be wearing the mask, and you can start all over again. So we're really getting really close to the finishing line. The vaccines are coming. Now's the time to be hyper vigilant if you can. Wear a mask, socially distance, wash your hands, and absolutely avoid large gatherings at all possible.
Stay vigilant. All right, Dr. Teresa Amato. Doctor, thank you very much.
Thank you for having me.